Today is an exciting day. I want to thank Secretary of Health and Human Services Deb Sangvi. I want to thank Jose Penabad from Undue Medical Debt. I want to thank Dave Almeida from Blood Cancer United for joining us today. And to the many people who made today possible, and a number of you are here in this room, I want to give a hearty word of thanks. I want to get right to the news because it's very good news. Today, we are announcing that thanks to North Carolina's Medical Debt Relief Program and the partnership of every single one of North Carolina's 99 hospitals, that over the past year, more than 2.5 million North Carolinians have had medical debt totaling about $6.5 billion completely erased. I'll say it one more time for the folks in the back. More than $6.5 million in medical debt for nearly 1 out of every 4 North Carolinians, an average amount of about $2,600 erased. So many credit reports wiped clean. This is life-changing news for so many families. Medical debt is a tremendous burden that keeps families from financial security and emotional and physical well-being. For many people, the debt service serves as an anvil holding them back from opportunity and a better life, from getting a mortgage or a small business loan. People often feel shame when they don't pay their debts, even when it is impossible for them to afford them. Unlike most other forms of debt, medical debt is not a choice. No one chooses to have a heart attack or get diagnosed with a chronic condition. You just have to deal with it. Today's announcement will free people from the financial stress so that they can focus on getting healthy. There are many people to thank for today's news. Chief among them is former Governor Roy Cooper. I want to thank Governor Cooper for caring about folks' financial stress and for his creative leadership. Last year, Governor Cooper and former DHHS Secretary Cody Kinsley put gears into motion by working to enroll every eligible hospital in North Carolina into this state's medical debt relief program. It was a first-of-its-kind initiative that leveraged federal health care money to incentivize hospitals to erase people's medical debt. Most of the debt had been on the books for years. It only served to deprive people who had no way of paying it back of a brighter financial future. If they could have paid it, they would have paid it. So we used an existing federal program that benefits hospitals to reward them for relieving this debt. Again, debt that they were not going to collect anyway. In addition to DHHS, the partnership could not have happened without the willingness of our state's hospitals to help their patients. So I want to say a loud thank you to North Carolina's hospitals and to the North Carolina Healthcare Association. I also want to acknowledge and appreciate Undue Medical Debt, the nonprofit organization that has been working with the hospitals and patients to make this debt relief happen. This medical debt relief program is a true win-win for the patients, for the hospitals, and for our state's economy. I'll let the other speakers say a little bit more about the announcement, but today I want to celebrate this good news and all the folks who worked so hard to make it happen, and I want to give a special thank you to North Carolina's Medicaid team. They have been working their tails off through incredibly challenging time put on their shoulders by the federal government especially, but also our state legislature. I hope that today is a reminder of how important the work that you all do at North Carolina Medicaid for the good of the people of this state. The program blew past the impact we anticipated when we got started by billions of dollars. It's an example of innovation and collaboration to improve the health and economic well-being of the people of North Carolina. That's exactly what people want out of their government. We can do it again. That is why I am calling on the Senate and the House to put their non-Medicaid disputes to the side and come back to the table to fully fund Medicaid in North Carolina. The two chambers agree that Medicaid needs more money to operate. The two chambers even agree on how much more money is needed to operate. The two chambers agree that the cuts to Medicaid provider rates are hurting people, especially in our rural areas. The General Assembly needs to send me a clean Medicaid bill when they come back to town in a week and a half, and I will sign it. In Washington, D.C., our leaders from both parties need to come together to extend the ACA subsidies and stop people's health insurance premiums from skyrocketing, 60% on average. We have so much work to do to improve people's health and financial well-being, but this announcement serves as a reminder of how much we can achieve when we work together. You'll hear stories from Jose and Dave about how this debt relief is benefiting North Carolinians. People like Michael and Deanna, who both faced life-changing medical diagnoses and then life-changing debt just from trying to get treatment to stay healthy and alive. People who now have a chance to get their health and their financial lives back on track. So let's keep this momentum going. Let's keep putting money back in people's pockets, not leaving them high and dry. Let's keep investing in people's health. I'll now bring forward Dev Sangvi, Secretary of DHHS. Dev.
Good morning, and thank you, Governor Stein, for that kind introduction. It's truly an honor as we share this announcement that is impacting millions of North Carolinians, giving them a fresh start from the burden of medical debt. We're so proud to announce, as you've heard, $6.5 billion, that's billion with a B, in medical debt has already been relieved, and that number continues to grow. I'm grateful to our team from NCDHHS for their commitment and work on this program over the last year. I always take an opportunity to ask those from DHHS to please raise your hand, because I think it's important that we recognize the great work you've done. So if you're at the agency, quickly, please raise your hands. Thank you very much for the work that you're doing. We would not be here celebrating this milestone without each and every one of you. I would also like to acknowledge and thank former Secretary of Health and Human Services, Cody Kinsley, who is here with us today as well. Cody, thanks for all the work that you have done as well. As you have heard, his vision, along with Governor Cooper, helped make this life-changing program a reality. The relief of medical debt is not just financial relief. It is a step toward better health and peace of mind. Medical debt doesn't just sit on a balance sheet. It creates a cycle of stress, delayed care, and worsening health, and we are now breaking that cycle. At DHHS, one of our key priorities is to focus on whole person well-being by addressing the complex non-medical factors that impact health, and personal finances is certainly one of those. Unlike most other debt, as we've heard from the governor, medical debt is rarely voluntary. People do not choose to get sick or injured. It often rises unexpectedly and can exceed a person's ability to pay, damaging credit, limiting access to housing and jobs, and causing people to delay needed care. And all of this is occurring when oftentimes in healthcare, you don't know what you're buying, you don't know what it costs, and you get saddled with the debt. So when we help individuals and families overcome these barriers to care and treatment, we not only make our state healthier, but we also allow North Carolinians to thrive. As a physician, I've seen this firsthand, how debt can get in the way of individuals and families getting the care they need. Countless times I've worked with patients who have foregone care because they were worried they would be asked to pay their debt if they went to the hospital. While this debt can be negligible for the hospital, often uncollectible and more costly to manage than it's worth, it represents a heavy burden on the individual. What's important to note about this program, this is not a one-time fix. It is a sustainable model that will continue to reduce debt burden and improve access to care in the years ahead. This initiative has put into place policies and practices to prevent low and middle income North Carolinians from incurring health-related debt in the future. I want to thank all of the eligible hospitals who signed on to this effort. I'm particularly proud to say that I was CEO of one of these hospitals prior to becoming secretary. We are unified in our commitment to help the people we serve. And this speaks volumes about what we can do when stakeholders come together. This is how we build a healthier North Carolina, through creativity, compassion, collaboration, and consensus. I'll now welcome Jose Penabad, Vice Chair of Undue Medical Debt, who has been an incredible collaborator and leader in the implementation of North Carolina's medical debt relief program. Jose?
Good morning, and thank you for having me here today. My name is Jose Penabad, Vice Chair of Undue Medical Debt, and also a proud resident of the great state of North Carolina. So I sincerely want to thank everyone in this room who helped make this happen, particularly Governor Stein and Secretary Sangvi, for their leadership in helping address the issue of medical debt in North Carolina, and for allowing us to partner with you all in forgiving $6.5 billion of medical debt for 2.5 million of our neighbors. Those are the people we're helping here today. Undue will begin its notification process this week. We expect to be sending over 255,000 letters to people this week to notify them that their debt has been relieved. I am very grateful to be here today. It's not every day that the work that you do touches the lives of millions of people. So I want to thank the team at Undue Medical Debt for allowing me this honor to represent our charity and for their tireless effort to end medical debt for all Americans. Our charity's mission is straightforward. We want to end the scourge of medical debt in America with a goal of putting our charity out of business. We firmly believe that when communities can access the medical care they need, when they need it, and without fear of financial ruin, our communities are stronger, they're healthier, and they're happier. Medical debt, as both Governor Stein and Secretary Sangvi have said, is a terrible name to call this thing. The word debt in our society suggests that someone had a real choice in the matter, as they do with their other financial debt. It's not like someone woke up on a Saturday and said they want to end up in the ER with a $20,000 bill for a good time. This does not happen. This is not a choice. If you are unfortunate enough to find yourself burdened with this medical debt, it is because a number of already horrible things have happened to you that day that culminate in insult and literal injury when you find that you can't pay this debt. Nearly 1 in 3 Americans per KFF are burdened with medical debt. We all know someone who has been impacted by this, or you know of someone who has known someone impacted by this. It's easy to see why this number is so large. 50% of American adults say that they do not have $500 for an emergency, yet in North Carolina, a single adult's deductible for healthcare insurance is $2,200. You can quickly see how an unexpected medical event can snowball into a financial disaster for someone who can't afford $500 in an emergency event. Undue works with over 300 providers nationwide, including more than 25 state and city governments. But as a resident, I am particularly proud to highlight that North Carolina's approach is completely unique because it facilitates in the short term debt relief for families today while incentivizing long-term policy changes that will end the cycle of medical debt by attacking it at its root cause, ending it before it even starts, so that these unpayable medical debts don't infect our communities with this sickness that is rotting in us today. And it's this combination of short and long-term fixes that our charity appreciates the most about North Carolina's approach. Make no mistake, debt relief provides North Carolina families with welcome relief and hope for the future, but it is no silver bullet. And as much as I am proud of the work we do and to get to stand in front of all of you today, in front of my wife and my daughter, I really hate to say that we're here helping 2.5 million people who needed help from medical debt. Undue is committed to upstream policy fixes to solve medical debt at its root so that our children and our neighbors' children never need to know the pain and suffering of this type of event. And finally, despite the negative headlines and the sometimes hopelessness with which people discuss the issue of medical debt, North Carolina set a tremendous, shining, bright, positive light to show that states can do active things to protect their residents and can advance a positive solution that is done by multiple groups of providers, by the states, by the people involved in the care of our neighbors, and cross parties and finding a real solution. I am so proud to be here today. I want to thank everyone for allowing me to be here, and I believe our work is just getting started. And with that, I'd like to hand it over for Dave for a story about our work. Thank you.
Good morning. My name is Dave Almeida with Blood Cancer United. At Blood Cancer United, we are on a mission to cure blood cancer and improve the quality of life of all patients and their families. And I'm joined this morning by Emily Blust, who serves as the Executive Director of Blood Cancer United here in North Carolina. I'll start this morning by saying thank you to Governor Stein and to Secretary Sangvi for their leadership in bringing much-needed relief to North Carolinians with medical debt. And I would be very remiss if I didn't also take a moment to say thank you again to Governor Cooper and to former Secretary Kinsley for the innovation and the creativity they brought to addressing this very serious issue. Medical debt doesn't just drain bank accounts, it drains hope. People tell us they feel trapped in medical debt and see no way out. They tell us that they have had to forego medical treatment because of medical debt, and they tell us that they spend nights worrying about whether to pay the medical bill or the rent because they can't afford to do both. Behind every medical bill is a story. It's a story of Michael from Mount Airy, who once told me that he became so concerned about the debt he was accumulating for his blood cancer treatment that he felt he could not, in good conscience, impose that burden on his family. So he told me that if things got worse, he was willing to forego treatment, even at the risk of his life. It's the story of a blood cancer patient in Charlotte who had a lapse in insurance coverage and incurred more than $30,000 in medical debt. Things were so bad at one point in time that she decided to avoid getting her treatment port cleaned once a month in order to save money. And then it's the story of the blood cancer patient who accumulated more than $200,000 in medical debt, which is already in collections. Blood cancer patients and survivors, for blood cancer patients and survivors, North Carolina's medical debt relief program is a welcome off-ramp. It restores hope. It provides peace of mind. It means no more GoFundMe campaigns, no more personal fundraisers, no more sales on Facebook Marketplace, and most importantly, it means no more calls from the debt collector demanding payment. Thank you again to Governor Stein, Secretary Sangre, Governor Cooper, and Secretary Kinsley. Blood Cancer United applauds your efforts, and we stand committed to working with you to further this partnership. Thank you.